Welcome to the Ideas podcast series funded by TU Rise. I'm Dr. Valerie McTaggart, a lecturer and researcher at Atlantic Technological University. RISE at ATU is co-funded by the Government of Ireland, European Union, Northern and Western Regional Assembly and the Higher Education Authority. On today's podcast,
older adults are gradually being pushed to the margins of society.
Good day. Today we're being joined by Chandler Tyrrell, and Chandler is looking at health outcomes of socially excluded older adults in the age of digitalisation for a part of his PhD in ideas. So good morning, Chandler.
Good morning, Valerie, and thank you for having me.
So Chandler, what inspired you to focus your PhD research on social exclusion among adults over 65, particularly those on the margins of society?
Yeah, so I applied for this PhD specifically from personal experience, but also from a professional curiosity that due to the rapid evolution of society because of digitalization, older adults are gradually being pushed to the margins of society and excluded.
And particularly now that we have an aging population, this is something that's going to become to the forefront in terms of, because everything is digital now. So prior to your PhD, what was your background? Where did you work, or what's your previous experience?
Yeah, so I finished school and left school at 16 to become a hairdresser, which opportunities led to work on cruise ships, where I became a manager of the spas all around the world. I did that for 7 years, came to Ireland to work at Centre Parks in their spa and be manager of retail. And within 4 months of starting, everyone was in lockdown. And at the time, obviously, I was away from my family, but the place I was renting from, the landlady, her name's Barbara, we ended up socially isolating together, and it turned into a friendship or a companionship, if you like, because it was just us two. While everyone's experiences of lockdown was different, mine was a chance to realign and reassess, thanks to Barbara and her years of wisdom, to really decide and move forward of what it is you wanted to do. And I'd always wanted to go to university. I always wanted a degree. Unfortunately, when I was 16, opportunities didn't allow that for multiple reasons. So with Barbara's critical thinking and insight to knowledge for me, it gave me that confidence to apply to do the degree here at ATU Sligo, which I did well, and I got my degree in business and ICT. And thank you very much to all my lecturers who supported me to get me through my degree. And then I saw the opportunity for the PhD and applied on that emotional but professional curiosity as well.
And that's really interesting. So in terms of your research, for listeners who may not be familiar with the term, how would you define social exclusion in practical, everyday terms?
Yeah, so social exclusion is a multifaceted, complex construct where an individual or a group has a lack of resources, rights, or goods and services that others in the community may have access to. So keeping it on topic from the elderly. And the really important thing here is that social exclusion can be on one domain or multiple domains. So one example could be an older person is socially excluded through transport, healthcare, or social interaction. And I say it's a multifaceted, complex construct because we could talk all day about what social exclusion is. The area of my research and is under an old age exclusion framework by a researcher called Kieran Walsh. And he breaks it down into 6 big domains. The domain that I'm under is social relations. And underneath here are some subdomains. Specifically, loneliness and isolation is the area of my research that I will be focusing on.
And, you know, with an aging population, and loneliness has been called a public health crisis. I think actually Sir Mr. Ball called it an epidemic. From your perspective, why is it such a complex and makes it such an urgent problem that we should be addressing?
Yeah, and that's a fantastic question. Answering from my experiences and the readings of the literature so far, what makes it complex is that multiple levels to it. So a person can be socially excluded on one level. They can be socially excluded on multiple levels. It's one of those of each experience will be different. What makes it further complex is because of each person, and we'll say from the older generation, they might be from a different culture than the person next to them. They might be of a different age range than the person next to them. They might be of a different socioeconomic status. These are further layers that add to the complexity of social exclusion. And what makes it urgent, and this is going to lead into something else I'd like to discuss. The term itself is used interchangeably with loneliness and social isolation. And that adds that further level of complexity where what is it that's being addressed? What is it that's being discussed? It's urgent because of the impact of what it has to older adults' health. So from the readings that I've seen, it gives mental health challenges such as anxiety, depression, can also lead to suicide ideation. In further publications as well, it's linked to chronic illnesses and has the impact of smoking 15 cigarettes a day and obesity. And this all leads and contributes to the quality of life. So as complex as it is, there is more than enough urgent reasons that it's being addressed.
And do you think that society still underestimates the impact of isolation for older adults in terms of, you mentioned something there like anxiety, depression. Do we fully understand the impact of this?
From anecdotal, from what I've read as well at the minute, social exclusion, we are moving in the right direction, but there is a lot to go to understand how it impacts each individual in terms of social connectedness and social relations. And that can be from digitalization. That can be from those multifaceted factors of social exclusion, or it can be cultural, socioeconomic status of that individual as well.
And I suppose when we live in a society where everything is digitally and digitized, you're studying the role of technology, for example, smartphones, wearable devices, connected medical devices, etc. Can you share some examples of where your research so far, I know you're at early days yet, illustrating that technology has improved social connectedness for older adults?
Yeah, so I'm specifically technology-wise focusing on digital health. So I'll be looking at the use and the aid of technology and information communication tools on monitoring, measuring, connecting people in health, so to the healthcare. One example that I've come across so far from a benefit is wearables and applications that help monitor that person's health. So they're able to see their ECG, they're able to have a reminder of when to take their medications. That's one benefit that's helping them for their health. The other benefit as well in terms of social connectedness though is telemedicine. So an older adult may no longer need to have the long drive down to the hospital, the waiting time into the appointments, when they can have a phone call or a Skype call or whatever app they're using to check in with their healthcare provider for their blood test results. They could even have a text message saying these are the results of whatever test they've had. So on that side, it's a massive benefit for efficiency. My research also lets me, and I hope to gain a balanced view of it, because while those are the benefits of digital health, have you heard of the Clare Island project?
No.
the Clare Island project is fantastic. It's obviously down on Clare Island, and it's a health initiative to ensure healthcare equity in the rural island of Clare with digitalization and digital health. So they've got, as I mentioned there, like they've got apps that measure and help give that autonomy to the residents, because the residents of Clare Island is about 165. Most residents there are of an older generation. So giving them that autonomy to monitor their health is fantastic. Letting them connect, again, for the mainland, because again, you imagine if you're on Clare Island, you have to get, for those of you who don't know, you have to get from Clare Island to the mainland, which could be a ferry, could be a boat. If the weather's bad, you're not coming to the mainland that day, you're going to miss your appointment. That's your health affected. Even though you get to the mainland, you might have to then get another bus all the way down to Galway, or heaven forbid, you got to go from one side of Ireland, the country Ireland, to the other side, into Dublin to see. All that time, all that waiting to get and see your appointment that could be a phone call. So people are seeing the efficiency and saying, this is brilliant. But what my research has presented is, especially on the Clare Island, people have mentioned the reliability, digital health. One gentleman in the findings said, he'd been driving all day, but the monitoring suggested that he'd done a lot of walking. So the confidence level is still developing in that. But coming back to that person, or that example that I gave anecdotally of getting from Clare Island to the hospital, those social interactions at the expense of efficiency are no longer there. So if they're not going to have the interaction with the person on the ferry, they're not going to see someone that they went to school with or a friend to chat with, they're not going to be chatting to the receptionist, the bus driver, the people in the reception. They're not having that face-to-face with their healthcare provider. What is the impact of that in terms of their social connectedness? Because for some people, that's their only interaction. So they're becoming socially isolated at the expense of efficiency. And some people want that efficiency. Some people need and want that social interaction for their well-being.
And that's a really good example, because, and I'm not familiar with the project, because the ease of having your health appointments, whether on Clare Island project or in any rural area, you may have to travel to specialist clinics from the Northwest region to Galway or Dublin. It's a significant burden on people in terms of access to transport and so on. So the benefits of doing these health interactions in a digital platform and that communication is excellent. But on the flip side of the coin is that those interactions mean that the human one-to-one in-person contact is somewhat negated, although you're speaking to the individual maybe in a virtual platform. So it's trying to balance that in terms of connectedness, but also the health benefits. So it's definitely a very interesting one. So if policymakers were listening right now, which we hope they are, what would you want them to understand about the relationship between social exclusion, health, and technology?
I want them to understand that they're, and I'm sure they are aware, but really stress the importance that they are interconnected. So that example that I gave there, efficiency, fantastic. That's improving, getting their results to them about their health then and there, and it's using technology. But the social connected side there, their relationships, is being removed. It's sitting down and being cognizant is the only way to put it, of when they're designing and creating their policies, when they're reviewing them, to really think about the implementation of them, but also the inclusion of older adults is the key part. Because I've only just given an anecdotal example. For some individuals, they'll want that efficiency. Some people want that social interaction. So it's taking that first-hand perspective from those with the lived experience of the older generation, and being able to have those policies, those technologies co-designed with them for the benefit of them and their health.
Yeah, and sometimes, although these digital devices are incredible, I don't think anybody would argue to that. Sometimes the people that use them are not being engaged with during the design process, and we see this in all walks of life. Hence the reason, like 70% of digital transformations fail. So, in terms of older adults engaged with these digital developments that directly are potentially for to improve their lives, how involved are they in the design phase of these?
To add on that one, I haven't actually come across that yet in my readings. There's longitudinal studies, there's qualitative studies that there is a level of inclusion, but I honestly couldn't answer to the level that they are included.
Yeah, and which would be really positive for the developers, but also in terms of their uptake and usage. I know the Clare Ireland project is a very uh, interesting one, because if it works there, potentially it can be replicated not only nationally but internationally, because the populations are aging. That's the reality, whether Ireland or globally. So looking ahead, what changes, Chandler, would you make in society policy or technology? Would you most like to see as a result of your research?
That's quite a position to be in, to have that. I definitely have a research team with me to support. I wouldn't do it alone. It's really stressing that co-design, that inclusion of having that voice, of having that feedback loop from the older generation, of their firsthand, of how it's implemented, what is their way of adopting technology, what are the barriers that they're experiencing. That would be where I take that feedback to then go out and implement that policy, that creation moving forward for them.
And it's like all advocacy, nothing about us without us, to include whether it's, young adults or older adults, it's having that voice at the table and listening to that voice, but more importantly, hearing that voice. So, a different avenue. So you've come back to education.
Yeah.
Big change from, very customer focused type roles back to your undergrad, very successful in your undergrad. So what challenges have you faced during your PhD, and what advice would you have going forward for others who maybe like yourself had successful careers, but maybe thinking, I would really like to do a PhD?
Yeah.
Any advice?
It'd be two things. It'd be balance, the first one. It's already I've encountered on the PhD, it's very easy to get carried away. And sometimes it's very hard to even get started. So there are some days that you come on in, you start at 7 o'clock in the morning, going through your articles, you're adding to your literature, you write it down, you're doing your modules. Next thing you know, 7 p.m. at night, probably a good time to eat. Then there are some days that, you start 9, 10 o'clock, you pick up the article, you've been staring at this article, or you've been writing an extract for about 2-3 hours, and you're still only on the first paragraph. Having that balance to understand that some days will be more progressive than others, and some days will be more resilient. Something that was always said to me was, if you can give 70%, 100% of the time, anything can be done. So it's just having, for those individuals in the PhD, to have that balance, to have that understanding of balancing the workload. Now, that's not including factors of life, because again, going from a lovely work salary to a stipend is a big change. You have to adapt to that level of being frugal and cautious of your spending. So you might not be having as many coffees out, you might be making them at home and things. It's a worthy investment long term, I can say already. For me, you've also got to balance friendship, being part of the community, and for myself, it's balancing family as well. So I have a 7-month-old son now, which he honestly is the joys to my day at the end, especially with a lot that I read or explore, especially in terms of loneliness, social isolation, under social exclusion. To come home and see him is a balance and form for me to keep on going and have the next day recharged. What was the second part of your question, Valerie?
No, it just really, what advice would you give to somebody else who may be thinking about embarking on this journey?
Oh, you do it. You do it. You need a Barbara in your life to sit there and chat to, whether it's yourself or that family member to bounce off. I mean, I'm very blessed with the support of family and friends that I've had. They've all been very supportive and encouraging of this venture of the PhD. Just do it. It is far better to jump in and do it. If you think you can do it and you've got that resilience, you go. If you've got the discipline to plan and follow through, just do it. And these are all skills that you pick up very easy around those that you're around, because under the TU Rise cohort, it's more of a community that there is that level of support. You need an article, you need a reference, you just want a second pair of eyes, very well connected in our community, and you don't feel alone when you're doing it. You feel that sense of, oh, I can do this. I will get through it.
And that's lovely to hear. And I think it is that, you mentioned at the start that you had always wanted to do a degree. You pursued that dream. And I think with a PhD, it's one of those things that if it's in your mind, it's definitely something to consider. And we've had Neil and yourself both come back into education for leading successful careers. I think that's the advice I've got for both of you. So that brings us to the end of today's conversation with Chandler. And if I have a couple of takeaways, Chandler, I hope I do this correctly. So we're talking about social exclusion, and under that, a larger umbrella term, for want of a better word, we're talking about loneliness and isolation. If there was one thing that we could advise policymakers, is to include people nothing about us without us. And if there's anything else that we could encourage somebody who's thinking about a PhD, balance is key and just do it. You can find us on INC2U's social media channels around Spotify and YouTube. We also are on the Ideas webpage. And next time we'll go into this topic in more detail with an industry professional who is looking at this technology from a practical perspective. Thank you for listening. That's all for now. Slán.